Hello everyone, my name is Emma Jones and I'm doing my project over psychopathy, sociopathy, and antisocial personality disorder and why it is important to know the signs in children. I'm going to start with psychopathy. A psychopath is when a structural and functional deficit in the brain causes impaired emotional responses, lack of empathy, and poor behavior control. This also commonly results in persistent antisocial deviance and criminal behavior. As a psychopath, you may experience some of these. I'm going to keep it paused so that it is easier to read. Risk factors are biologically based with a hypofunctioning of paralimbic brain circuits and or a traumatic brain injury to the prefrontal cortex. Hypofunctioning is basically just a lack of functioning. Although psychopathy is biologically based, traumatic events can also accompany those factors. Next, I'm going to go over sociopathy. And sociopaths are individuals who are emotionally stunted due to certain events in their lifetime. They are more unable to live seemingly normal lives due to erratic behavior without regard for getting caught. So, in contrast to a psychopath, sociopathic behavior is mostly a result from social concepts or some sort of traumatic event. These are some of the risk factors. The risk factors do not end here, but these are just a few. These include sexual abuse, emotional abuse, a traumatic event, like I stated earlier, physical abuse as well. As a sociopath, you may experience some of these. As you can tell, some of these are consistent with psychopathy as well. Next is antisocial personality disorder, and according to the DSM-5, it is a disorder in which individuals persistently disregard and violate others' rights. It is often thought of as a psychopath or sociopath, but instead, it regarding the DSM-5 basically merges some factors and some criteria from both psychopathy and sociopathy and create a single diagnosis. If you have ASPD, you may experience some of these. Some risk factors include absence of love in childhood. Antisocial symptoms were actually learned. So a guardian, a family member, a peer, or peers could exhibit or perform some of these antisocial behaviors. Parents unknowingly enforce antisocial behavior. So, for example, a child could hit, scream, kick, punch their parent in the face. And in order to keep embarrassment at a minimum, a parent will or can bribe their child with something that would gain their attention and cause them to stop their behavior. This can unknowingly almost enforce and reward a child for acting this way. This can also be a biological impairment in the brain. And these are all according to the models explaining ASPD. And like I stated, ASPD is a diagnosis in the DSM-5. Next, I have why is this important? And in the brown to the right, I just wanted to emphasize that caretakers, educators, family, guardians, medical professionals, and basically anyone who is able to accurately educate themselves on risk factors and behaviors in young children can exponentially improve the quality of life of a child exhibiting these behaviors. It is important to note that research has shown that treatments are mostly ineffective in adults, and if intense enough, can effectively treat children. I'm going to go over some of the signs and symptoms in children and then refer to the treatments after. So on the right, there are 6 possible risk factors that the DSM-5 lists as, diagnosis for ASPD. These 6 are destruction of property, they disregard rules and laws, patterns of severe aggression, premeditated crime, theft, and aggression toward people and animals. It is important to note that a person can only be diagnosed with ASPD if they are 18 years of age. It is commonly found in those that are diagnosed at 18 or older, have exhibited or have behaved in a way that is consistent with ASPD being diagnosed in adulthood. I also want to say that it is very important to be able to differentiate between troublesome youth behavior that is sometimes common in certain areas and in age ranges, and compared to an abnormal pattern of consistent deviant behavior that warrants major concern. Again, this is why this is a separate diagnosis versus conduct disorder or other disabilities or deficits. The types of treatment that I have read include these 3. The bullet in white is treatment used in research apart from the DSM-5. That is cognitive behavioral therapy after a traumatic brain injury in children. It is extremely effective. It is extremely intense and more effective in children than in adults. Cognitive behavioral therapy is used to bring awareness to others' needs and identify and analyze their moral issues. People with this diagnosis often do not know other people's emotional needs and may not care to care for people and the needs that, care for people in ways that they need. They also can analyze their moral issues or their behavior, pointing out to these patients what is inappropriate and how not being worried about repercussions can affect them. This is not usually effective, especially in adulthood. Medications are sometimes used, specifically antipsychotics, but this has not been found to be especially effective. Before I go to references, I am wanting to state that the differences between these 3 areas of research are that psychopaths are believed to be born, are believed to have a genetic disposition. Sociopathy is believed, research states that sociopathy can be caused or can arise from traumatic events in childhood and are a social construct. Antisocial personality disorder takes criteria from both biological and socially based impairments, and are grouped into a single diagnosis. I also want to add that people that do exhibit or do act in some of these ways does not necessarily mean that they have this diagnosis or any diagnosis at all. And here are my references. And that is all that I have for you guys.